Actually, this is an experience where I was not the doctor, but I was a friend of the patient, and I could see things from the other side. And that's what really made me realize that sometimes how difficult it is for patient and patient's relatives to know exactly what is happening, especially during COVID times when you really can't communicate with the doctor or the treating staff. And but overall, I had a good experience. This was a good friend who had served with us in the army, and he suddenly he had COVID over the last 5-6 days, but his oxygen saturations fell and he needed a hospital bed. He was in Delhi, so I was remotely trying to arrange a hospital bed for him. And after that, keeping track of how he's doing and whether he's getting the required treatment and how he was progressing. So it was quite nerve-wracking, but luckily everything went well and he recovered and he got back home. So it just makes you see, gives you a perspective of the other side of things, and makes you more humane as far as your treatment of other patients goes. I think for any doctor, once you start treating your patient like you would like your relative to be treated, you automatically do things right for that patient.
Challenging task was during COVID. The two family members, they are getting admitted in a different hospitals. And one of the patient was admitted actually in a government hospital. The wife of that patient has to be admitted in a private hospital. And the other family members were also positive, so they were not in position to go and meet. And that patient who was admitted in a government hospital unluckily died. So that was one of the biggest emotional issue which I had handled, because of the family members were closely known to me and I was knowing them since long. And that was a very emotional moment. At the same time, the challenge was also there to take care of these patients who is in the hospital where the relatives can't go and meet them. And I have to just ask them how they are. The patient who was in private hospital there, I was again connected with the doctor who was treating. But the patient who was in the government hospital where, I was not even directly connected with the healthcare provider also. So that was really a difficult time for me but there was many such moments. It's not like that in last 1 year we could have only one such patients, multiple such patients, sometimes our relatives, our friends, and even their parents also. And getting admitted in different city also. So we were having the patients who was actually belonging to Ahmedabad, and because there was no place in Ahmedabad, and I had to admit a patient to the Nadiyad, which is 100 kilometers away from this place. Or even I was taking care of one of my relative and one of my patient in Jaipur and Kolkata also, where it was more difficult. So there were multiple such challenges were there, but emotional challenge was that one of the spouse member is dying and then they can't see each other the last moment, and that was very difficult to explain. The relative was again a very big challenge for us.
Actually, during this COVID pandemic, one of my breast cancer patients got admitted because she was suffering from COVID. She was ultimately put on BiPAP. But at the same time, her husband got admitted in a very serious condition in the ICU, was under ventilation. But ultimately, he didn't survive. And every day I had to answer my breast cancer patient about the well-being of her husband. So it was so emotionally draining because I went on telling white lies.
All of us doctors who have taken the Hippocratic oath realize that we try and do our best for the patient. It may not always be that things work out the way they should, because it depends on the condition the patient comes in, what complications the patient has. The patients, on the other hand, and their relatives should realize that the doctor is giving their best. And I think this is what keeps us going. As long as you're sure that you're doing your best for the patient, I think you continue doing the good work.
So the healthcare practitioner violence which is getting in our country is maybe because of some of the people, they don't understand the system. It's a biology. And I always try to explain my patient that what we understood in last 10, 20, 30, 40 years, everybody started doing good calculation and we become more of a logical. And we started thinking then 1 and 1 has to be always 2. But that does not happen in biology. we are dealing with medical science, we are dealing with a person, 1 and 1 sometimes can become 11 and sometimes it may become 0 also. So this explanation is very important to the patients and their relatives. Every time their expectations are very, sometimes very high. So we must explain them that this may not happen in real world, because something else which is taking care of your health. It's not just the medicines which will work exactly the way which we are looking for. So this is one important thing, but still there are such type of incidents which we listen every day or we see also. But the thing is, this is a professional hazard and we must continue the work. We should continue good work for the society. That is what I can tell my colleagues and all my fellows.
So I think we do notice a lot of violence against healthcare practitioners, which is very disturbing, very depressing also. But what I have observed is that we must change the way we look into our patients in our clinical practice. Their demands have increased, of course, but that is their patient's right, which we must understand and accept. And what was a very different type of practice, say a decade back, that was a very authoritative practice where I used to call the shots. What I felt right was being prescribed. But I have changed my way of thinking. And nowadays, I involve the patients also in the decision making. So this type of participatory decision making has really changed the modality and the mode of our clinical practice. This is, I think, more healthy, more cooperative, and naturally, once they participate in the decision making, their frustration or their tendency towards violence against the doctors will also improve.
One realized that the healthcare system is not as robust as it should have been. However, we were not so badly off as the rest of the world was concerned. We were fairly good in comparison, only our systems were not in place, and our systems had to be put in place, which we did a fairly good job of. Given the circumstances, given the resources we have, I think India did a very, very good job. And now we are gearing up for a probable third wave. We hope it doesn't happen, but if it does, I think we should be able to encounter it in the right way.
So in healthcare system, in two ways changed very much. One is we become more digital, online consultation, on phone, distant consultation without seeing the patient. So from the doctor's point of view, we learn a lot, not just the physical examination, but on history, how you can diagnose some patients by getting the different information, and then you are diagnosing and writing the medication and follow up how you do. The second thing we learned is a lot of continuous medical education, which we started doing online platform. But from patient perspective, what I think in 2020, everyone could understand that a comorbid condition is very, very important. If I am a diabetic, if I am obese, if I am hypertensive, if I am not taking care of myself, any infection, today maybe the COVID, but tomorrow something else may come. And I am more prone to develop more problem in compared to the person who does not have it. So if I am having diabetes, as a diabetologist, I will give the message that please monitor it more frequently. Try to keep it as tight control as possible, and go and visit your doctor as frequently as possible, and at least on a regular visit you should do. It is not necessarily you should always go to a consultant or your diabetologist. You may have your primary care physician. Even distant consultation or online consultation is possible. So do it and keep your sugar well controlled.
Oh, the healthcare system in 2020 taught me many things. But I think the most important one amongst this was I learned the importance of oxygen as a drug. And our entire unit, we have pledged to really accept oxygen rationing and thus avoid misuse against the use of oxygen.
Every doctor is already doing his best, and everybody has really worked hard during this pandemic. And I would like to tell everybody, continue doing the good work you are doing. Whether it's appreciated or not, I think we should all continue doing it.
So I think all doctors, we should promote vaccination. See, we were promoting the social distancing, we were promoting all other things, but now I think this is the time we should talk about the vaccination. Each one of us, whoever who is working with you, your relatives, your friends, your servant, your associate, anyone to whomsoever you meet, you please tell them, please get vaccinated. That's the only way by which we can, this pandemic or the third wave may not come if we do vaccination properly. So I mean, that is the only thing which we should do the message, and more such positive message should go, because there are a lot of myths about the vaccination to even the who are educated. They don't want to get it. So that is the one thing the healthcare professional can, whatever the myths their patients may have or the relatives or anyone, they don't want to take the vaccination. You should promote, you should convince them to take the vaccination.
COVID pandemic is here to stay. Stay safe. Take all precautions. Strictly follow COVID protocol. Take the vaccine yourself and promote vaccination amongst the community.